Hi, my name is Patrick Kennedy, and I am a person in long-term recovery, which means for me that I have not had to drink or use drugs or use any mood or mind-altering substance since February 22nd, 2011. I count my days of recovery because for me, recovery is what it's all about. I needed to get the medical interventions, and thankfully I was able to get them through the medical system, to get detoxed, to get stabilized, to get the mental health treatment, particularly cognitive behavioral therapy, which is the evidence form of treatment. But I also needed to get long-term sobriety. That has only been possible because of the community supports, because of the difference that it makes for me to have supportive housing, to have an occupation that supports me in my recovery. I say these things because as a person who has suffered from the disease of addiction most of my life, I know that it's not enough, although it's certainly crucial, to treat these illnesses in the medical setting, which as the author of the Mental Health Parity and Addiction Equity Act, the law in the United States which requires that addiction be treated no differently than any other chronic illness in terms of early intervention, prevention, treatment, and recovery. I am particularly mindful that our system often falls down when treating these chronic illnesses of addiction through supportive systems of recovery. We really do not know how to do that. And I would venture to say that's not only true in the United States, it's true around the world. And so as the World Health Organization tackles this issue of how to best treat addiction, I would only double down on the idea that recovery needs to be part of any broad-based plan and strategic initiative that you develop. Finally, and perhaps most importantly, if we want to address addiction as the public health threat that it is, we need to go to the source of where so much addiction happens, and that is because of our failure to regulate addiction for-profit industries. The tobacco industry, the liquor industry, the opioid industry. These are all industries we've done so much in the last few years to regulate because we've seen the nexus between profit and marketing of these addictive substances to more people. The public health, whether it's in the United States or anywhere else in the world, cannot compete with the for-profit incentive of commercial enterprises who only make their money by marketing their addictive product to more people, particularly targeting our youth. And that is why I have been fighting the commercialization in the United States of marijuana. We know that with money behind them, the marijuana industry will look at vulnerable populations as none other than marketing opportunities to make more money. And at whose expense? At the expense of those who will suffer from addiction because they are exposed and because they have easy access to these addictive substances. I also want to say it's been an enormous mistake in the United States to legalize gambling. And I know that is an addictive disorder that you will also be speaking about. So finally, let me just thank you for your attention to these issues, both in the public health realm, but also in those realms like our criminal justice system, which, as we know, for too long has been the substitute for a lack of an addiction treatment system. So many people with the disease of addiction end up in our criminal justice system, and if we develop any plan, it must make sure that it adequately treats addiction within the justice-involved population. Finally, thank you all, and I look forward to working with you and the UNODC in order to come up with those model bills that we can take to my colleagues around the world who work in countries and are trying to develop what the right regulatory and statutory infrastructure is that can help protect their populations in much the same way that I've been trying to do among my community in the United States, because at the end of the day, we are all in this together. Wherever we live around the world, these issues discriminate against everybody, and we have to make sure that we fight for everybody, because that other person might be your closest loved one, and it might be your child, your mother, your father, your sister, your brother. With that in mind, I'm so grateful for all that you are doing to tackle this issue and to finally treat addiction as the public health crisis that it is.